Hello everyone. Welcome. Please, as you are coming in, share the program. Share the program and you write something so that I know you are here and welcome you. Welcome, I miss you guys. How are you all doing? Lizzie, Camilla, Lizzie, welcome. No other person? Lizzie, okay, Lizzie, welcome. And I welcome everybody that is watching. I miss you guys. It's been quite long that I came live last, but today I said let me manage myself to come because of series of questions I received about the video I posted on high prolactin and getting pregnant. I discovered that a lot of women have this issue of high prolactin, and they don't know. In fact, that has been the cause of their infertility, but they don't know. So I want to talk more on the high prolactin and how you can go about it. Even if you do not join us live, you can watch the video later, because that high prolactin is something that if you have been trying to conceive, you must treat it. You must pay attention to it, because when your prolactin level is high, it can prevent you from getting pregnant. How? Because you might not be ovulating. Not even might, you will not be ovulating. So it's a very serious infertility case that you must pay attention to. Now, a lot of people are asking me, what is high prolactin? How do I know if it is high? How do I lower it? So we are going to look into this. I manage myself. I'm managing myself. So Ogechuku Jennifer, welcome. Oge, how are you doing? Enore Enore, please forgive me. Welcome. I cannot pronounce the remaining one, but I know Enore. Welcome. So we are talking about high prolactin and getting pregnant. What are the main causes of this high prolactin, and how can it affect your conception as a woman? Wow, my beloved brother is here. My brother, welcome. Thank you for watching your sister. I appreciate you. God bless you. Please, if you are joining us, see you guys see me. If you look at my face, you will not say my face no dey. I know they struggle, but I manage, because ever since I posted that video, I discovered that a lot of people are suffering from this high prolactin. That is why they are not getting pregnant, but they don't know. And they are asking me questions. I am not too strong to write or type. That is why I created this opportunity to come here today to explain. And my beloved sister, Tochi Ofo, is here. Please, guys, this my sister is a wonderful chef. Her page is Mira's Kitchen. Please, I will share her page in my community. If you want to learn how to cook delicacy, I beg, go and follow that page. Even if you don't want to learn how to cook, I beg, help me follow the page. You are going to learn a lot. It will not be a disappointing. Honestly speaking, you are going to learn. In fact, sometimes when I lack the idea of what to prepare, I always go there. Always go there to learn what I'm going. Like this evening, I've already watched what I'm going to prepare. So if you are the type of person like me that lacks food ideas, always go to Mira's Kitchen, and you understand. So the issue of high prolactin, I might not waste time, because if I talk too much, I have headache and I breathe so fast. So, but it touches my heart the way people are crying about this high prolactin. I want to enlighten you. There's no cause for alarm. There is something, the first step of solving a problem is identifying your problem. When you identify, a lot of women that have been going helter skelter, some people that have been told that they cannot give birth again, blah 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 blah, because the cause of your problem is not known. When you know the cause of your problem, then the next thing is you prefer a solution to it. So that is why I come here to calm your tension. When they say you're prolactin or whatever they tell you that you are suffering from, you don't need to kill yourself. Even if they tell you that you cannot conceive, tell them you can conceive, you can do it. Please, women, cool down, cool down. I always tell people, don't allow others to determine what you will become. You will be the person to determine. If they tell you are 46, you are 47, you will soon enter menopause, you will never give birth again, just leave that place. Go and work with your faith and your God. You will see it. I'm not trying to deceive you. I'm telling you the truth. Number one process of solving a problem is identifying your problem. Then you will know a way of solving it. So we are talking about high prolactin. I don't want to deviate now. High prolactin, you find this, men also have this prolactin. It is called hyperprolactin. I always call it high prolactin. Hyperprolactin. And what is this hyperprolactin? And what is this prolactin? Hyperprolactin means you have higher than normal level of prolactin in your blood. When something is hyper, it means that it is high. That is why I always refer to it as high prolactin. Now, the most common cause of this hyperprolactin is what is called prolactinoma. Prolactinoma. So that prolactinoma is a begin and is non-cancerous tumor in your brain, in your pituitary gland. It's not cancer. It is just a normal tumor that produce breast milk. Your prolactin level supposed to be high, supposed to be increasing when you are pregnant. But if you are not pregnant and you see your prolactin level increasing, it means that there is a problem in your pituitary gland. That is that tumor called prolactinoma. So you can go to Google or make research. If you are, the problem our people have is that we don't always make research. We don't study. We use our phone to watch nonsense that doesn't benefit us. Once your doctor tells you you are suffering from this, straight to Google, or if you have any doctor or anybody that knows more about this, you ask the person question, they will put you through. So instead of putting yourself in, some people when they tell them you have this, they will be shivering, dying even before the thing will even develop. The next thing you can do, just go and make research about that thing that you have been told that you are suffering, and see if there is a recommendation or a way that you can support yourself. Of course you can support yourself. So now, having said the meaning of prolactin and the main causes, some drugs, some medications you take can also make your prolactin level to be high. So in women, normal women that is not pregnant, the normal prolactin level in a woman that is not pregnant is supposed to be less than 25. Your prolactin level is supposed to be less than 25 when you are not pregnant. When you are pregnant, it will now increase to 80 to 400. Yes, this is when it is required to increase because you are pregnant, and the prolactin, the pituitary gland now produce enough milk. The real function of this prolactin is the hormone that is responsible for producing breast milk. So when you are pregnant, you're supposed to be high because it is preparing milk for the baby to take when the baby is delivered. Now, some women, I was shocked when somebody said her prolactin level was 200 or 100, and it is very high. And if you don't treat it, it's not only that it can prevent you from getting pregnant. If you do not treat it, it can lead to other diseases. It can lead to other, what do you call it? Can lead to other problems like kidney failure. It can hurt, So if you have prolactin, if you have high prolactin, please always work on it. So in men also have it. Men are supposed to be less than 20. But if you are not pregnant, some people may have prolactin, hyperprolactin, but they don't know, because the easiest way you can then identify that your prolactin level is high is when you have breast milk discharge. Some women, they are not pregnant, they are having breast milk discharge. That is the only way people can know. Now, what about people that have this and they are not having all these symptoms? So now, how would you know? That is why I encourage each and every one of you that is trying to conceive regarding your age. The first thing you should do is always go for hormonal profile to check if your hormones are good. Because I discovered why I started posting it, because majority people that are monitoring, that I'm following, if I ask them to go and do tests, hormonal tests, I always find out that their prolactin level is high. I say maybe this could be the problem. And remember, when you have hyperprolactin, you will not be ovulating. And I always said it, in the absence of ovulation, there's nothing like conception. There's nothing like pregnancy. If you don't learn anything from this page, you should always learn that if you don't ovulate, you cannot be pregnant, except through IVF. Even the IVF, they are going to induce you. They are going to give you follicle stimulating hormones to induce you to ovulate, because it's that egg. That ovulation means releasing of an egg from your ovary. So once the egg is released, they will collect it, fertilize it outside, and they is implant it back to your uterus for development. So if you have hyperprolactin, some people are saying, how can we reduce our prolactin level? What can we take? And some people, there's some question. If you ask me question, I don't answer you, please. And I need to apologize to you people. This time around, I am not strong. If you write me something I didn't reply, please bear with me. Very soon, when I become stronger, I will be replying. I don't have strength to type, but I read your question. That is why I force myself to come here today. So if you write to me, I don't reply, don't feel that I am feeling too big, or maybe I don't want to respond to your this thing. I'm not too strong. I don't even answer call this time around, because I know what my body can carry for now. But trust me, when I regain myself, I'm going to be replying. The people that I managed to reply is like the person that said her prolactin was 200. It's a very critical something. You need to explain to her the gravity of this thing so that she will take it serious. But any other person, people are writing me hi, hello, please. If you want to write anything, but not now, when I become straight, just go straight to your question. You don't need to ask me hi, hello. If you write me hi, I will come and say hello. You will say how are you. That is a chat. No, I don't do such. I don't have time. Just write your question there. Whenever I get strength or I see it, believe me, I'm going to respond to you. So some people are saying, how are we going to reduce this? And some people are saying, my period is not coming, what should I take? My dear sister, um I know something you can take that can bring your period, but have you ever tried to sort out why your period is not coming? Whatever happens to us give us sign, but we don't pay attention. Would I call it ignorant or what? If your period is not coming and you have not entered menopause, and besides, the official age of menopause is 50 years. Is 50 years. If you are 50 years, you are not seeing your period, it's a sign of that you are entering your menopause. But would I say because of pollution or the kind of food we eat or environment we are now, a lot of people enter menopause before 50. Some people start their menopause at age of 40. Some people, it's rare depending on when you start seeing your first menstruation. Your menopause starts because each month you menstruate, you lose egg. Each month you That's why sometimes some people will be told that they have low egg quality. Each month you are losing egg. So what am I trying to say? If you have not entered menopause and your period is not coming out, it's a sign that something is not well with you. What should you do? Go to medical checkup. Go and find out. It's always good to solve the root cause of your problem than solving it. Okay, let's say your period is not coming. You just want to see your period, right? The doctor may prescribe, oh yeah, take this. You force your period to come. If you force your period to come, you will still not ovulate, because you have not solved the reason. You have not solved the problem that make your period to cease. If it is hormonal imbalance, you need to balance it for your period to be regular. So Another thing is the same thing people ask, how can we, what can we take to reduce hyperprolactin, hyperprolactin? Now, my advice to you is this. Please, if you have gone for hormonal test, there's somebody I liked when she went to the hormonal test. It was discovered that her prolactin level was high. Then the doctor prescribed. She showed me the distance. I said, yes, this is good. I said, go and find out why your prolactin is good, not lower. Because if you continue to lower, you don't know when it will go down. The best thing is go and meet endocrinology. Some people are, I'm surprised that a lot of people in Nigeria, they don't know what an endocrinologist is. An endocrinologist doctors are the people that is specialized in hormones, and they see to the endocrine conditions. Like now, when you go there, if it is here in Europe, some may use ultrasound, and they will use ultrasound and blood test to find out whether your blood sugar is high, or there is any other factor that is making your prolactin, your pituitary gland, to be producing more prolactin. So it's always good. I am saying it now because some people will still come and ask me, what are we going to take to lower our prolactin? Please do not lower. Go and check the underlying factors. What led, because your prolactin cannot just be wake up and be high. There must be something that is affecting it, that is pushing it to increase. So what you should do is that you should, Sarah, I don't know if you are here, Sarah, or my brother, if you are here, please can you write an endocrinologist doctor? You go and meet them. And some people will ask, where can I find them? If you're in Nigeria, you go to any teaching hospital. They have, in the teaching hospital, they have their own office. These are specialists in this. They are specialists in this. They have their own hospital, but this is where you will go. They will give you the rightful information where you can locate this endocrinologist. Go to them, meet them. They will tell you will tell them your story, how your period flow, or some people with a hyperprolactin, their menstruation is not always regular. So these people will conduct it. They will now find the underlying factor that made your prolactin to be high. When they now find that factor, this is the first way and the best way you can cure this. Because if you continue on medication, you don't know when it's going to be reduced, because the main problem that is causing it have not been solved. I don't know if you people are understanding me. Some people will say, what can we take to reduce it? Some people will say natural thing. This type of things, they are, how will I put it? They are serious something. They are something that requires immediate attention. It doesn't need natural things work, but it takes time. But in this case, you need immediate attention, which means you need medication. And the best medication that can solve or reduce this is finding out the root cause of your prolactin being high, and the doctor will solve that root cause. Okay, let's say for example, you have your blood sugar level is high, and because of that your prolactin is high. So what your doctor or the endocrinologist can write to you is medication that can lower your blood sugar level. As soon as your blood sugar level is being reduced, then your prolactin level will stop. But if you are busy there taking any medication to lower it, but your blood sugar level is still high, my dear sister, nothing will happen. Okay, Sarah, welcome. Sarah, please write endocrinologist doctor, so that anybody who have this problem that I'm talking about now can also go to that place. Can you ovulate without having the symptom of ovulation? When I finish, I will answer you. Please, I always tell people to wait. Let me finish, because if you're asking me question now, I'll be deviate. So another cause of High prolactin is abortion, evacuation, and stress. And for young ladies, not even young lady, people who go for abortion, it can make your prolactin to be high. It can make your, if you are still 35, 30, you are still indulging in abortion. My question is for you is that what are you thinking? What are you thinking? Imagine you are 35 because you have not married, and they call the children unwanted. Unwanted is unwanted. How is it unwanted? Somebody who is 35, you become pregnant, you say it's unwanted pregnancy. I call that one stupidity. If you are 35 and you know that you don't want to have babies now because you are not married, you want to have them when you are married, now you start making this thing. When it enters, you said it's a mistake. That is not a mistake. You should be matured. So, and besides, you are 35 and you are still aborting. You know how the devil works, eh? This devil is very tricky and it follows us, the way we behave and the hands we give to the devil. Now, when maybe you are 35 and you are not married, and people shy away from having children outside wedlock, so the devil will not bring a man to deceive you. So maybe you become pregnant. The devil will now come with another brain. Ha, you want to keep this pregnancy. If you keep it, you will, if once you give birth, nobody will marry you again. No man will marry you. You stay in your father's house. It's better you abort it. You say it's true. You go and remove the child. Now, immediately you remove the child, husband will come for you. Believe me, you will marry, but before you become pregnant again, if I thought the person will become, that is when the series of problems will come. So if you are 35 and you are pregnant, please, even if the man refuses to marry you, keep it. Keep the child. You will never regret having the child again. Instead of causing problems to yourself, some of the what do you call it, hyperprolactin is as a result of abortion. Or people, yeah, Sarah, thank you. Sarah have written the name in the chronologies. These are the doctors that are specialized in hormones such as prolactin, thyroid, estrogen, and progesterone. They can help you to check your level. So Sarah, thank you so much. So, where did I stop? So, abortion, when you have abortion, prolactin normally is supposed to increase when a woman is pregnant, or when you are breastfeeding. It's supposed to be high. Some people use breastfeeding as what do you call it, as their contraceptive. They will keep on breastfeeding because as you are breastfeeding, you might not be ovulating, and the chances of you getting pregnant when you are breastfeeding is low. But in the issue of abortion, now the babies have been forcefully removed. You know that then the pregnancy have not matured. Assuming you carry the pregnancy 9 months and give birth, it will be easy for the prolactin, for the milk to come out easily. But this one is just, you forced it out. The milk is still there. The milk have not gone out. It's still there. Some will dry, but it's still there. Your prolactin will continue to rise. You will not be ovulating. This is problem. Sometimes stress can cause you to have high prolactin. If it is stress that is causing you, when you meet these people, they will tell you how to manage stress, then it will reduce automatically. If it is high blood sugar level, they will give you medication that will reduce and tell you what you should eat and what you should not eat, that will level your blood sugar level. Then everything will normalize. Instead of fixing your own, stop going to pharmacies. They know about drug, yes, but visit your doctor. Go for test before. Some medications you take can also lead to you having high prolactin. So nobody should ask me what medication you should take. The medication you should take is to go to this in the chronologies. And people that also ask me, my period is not coming, how can I get my period back? Go and do hormonal test. There must be something that is preventing you not to see your menstruation. When that thing is found out, it will be addressed and it will be coming out. You don't need to be taking anything every month for you to see your menstruation. So somebody asked me just now, how can I, is it possible to have ovulation without any ovulation system? Well, it depends on your body, but one thing I know is that ovulation is not a little thing. It's not something that will happen without you having any signs, except if you are ignorant, you don't pay attention. It's not possible. Once you are ovulating, some people might not know, they might not know this, but it is happening. It's only when you pay attention to your body that you will know. For example, if ovulation wants to take place, you will have, some people do have tender nipples, sore breasts, your nipples will be hot. Some people have fever, you'll be feeling feverish. Some people have high sensitivity. Some people feel tired. Some people have huge urge. Some people have lower abdomen pains. So there's no, I don't think it's possible for you not to have a sign, except if you are not paying attention to your body. So ovulation, I have done the video on signs of ovulation. Maybe you go and check it out. Ovulation is not, it's a mighty thing. When I regain myself very well, I'm going to bring out the video of how ovulation takes place. It's not, it's not something because it's not something that is soft. When it's coming, it's just like egg. Have you seen where chicken is laying egg? Is when the egg is being released, it's coming out from your body, you will feel something. So you must have a sign of ovulation. I don't know if anybody have question, because I think I have cleared myself. Any other question? So this is it for people with prolactin, and people are also talking about ovulation. Please, you guys should help me share. I discovered that you don't share my videos again. You don't follow the page. You don't like. You don't invite. Is it because I'm not coming live? If you are watching my program, I believe you are learning. Please invite other people to come and learn. Share the page, follow the page, sorry, so that you will learn more. Put on your notification bell. All these things are very, very important. I'm waiting for question, one or two questions. So this is it. If you do it the right way, if you do it the right way, if you follow your situation the right way. And I also want to use this opportunity to encourage somebody out there that you shouldn't allow people to decide to you your fate. You shouldn't allow anybody. Sometimes, and some medical practitioners, they don't know how to address people. When you get there, they will tell you you have entered menopause or this. They wouldn't even tell you what please, what does make discharge from the vagina means? It depends on this, and it depends on the stage in your cycle. For example, after your menstruation, when the follicles start developing, you'll be seeing some discharge. One, it will start from light makish. When it's approaching to ovulation, you will see it will start drawing. Now when it approach to ovulation day, you will not see it will be like egg white. So it depends. Some mucus discharge that is too sticky can be a sign of infection, depending on the stage of your cycle you are. It means it's only the test that can give you a solution, because my breast milk is coming out too. Yes, you need to go to the test first. Who is this? Gloria, are you pregnant or breastfeeding? If you are not pregnant or breastfeeding and the breast milk is coming out, that is the number one sign of hyperprolactin. Please, I want to ask, like, how many days is good enough for one to ovulation? Takes one day, 24 hours. just 24 hours. That is how ovulation lasts. Hormone tests, in Nigeria or in Africa, I don't know. Some lab in Nigeria, they will always tell you when your menstruation finish. But here, I think here the third or fourth day, the uh, third day of your menstruation, that is when they will have a very good result. When you are menstruating in the third day, on the third day or the last day of your menstruation, that is the best time to do hormonal test. That is the best time you can do hormonal test, and you get accurate result. This is my one. Okay. Thank you, Elizabeth. Yeah, thank you for this like. Please, you guys should share and invite people to learn. A lot of women out there, they are suffering. What pains me most is that they are suffering from what can what can be solved. A lot of women have been trying to conceive for 2027. Some even have given hope. They have given up hope because of the way they are being approached. Even if you are a doctor or any medical practitioner watching my program, please, you guys should mind the way you treat women who are trying to conceive. You need to cool them down, advise them, give them hope, not to stigmatize them, not to make them lose hope that they cannot become pregnant. You don't even test them. You don't even know what they are suffering from. Only thing you can tell them, oh, you are 26, you are 46, you are this, you cannot become pregnant, your womb. When you have PCOS, they will tell you, and especially in Africa, your womb is spoiled. That is not for me, it's not good. I believe God can do all things. I'm not pregnant, I'm not breastfeeding. I had a miscarriage in January, and since then I can't take in, and I have been trying to. Yes, you need to visit these people. um Glory, it means that your prolactin level, that is one thing I told you. See, this is the main problem of this prolactin. When you have evacuation, like you say miscarriage, abortion, it's always difficult for the prolactin to, to return to it normal, because is just like a force. But assuming you gave birth and you are breastfeeding, the milk will be coming out freely on its own. Then when you stop breastfeeding, then it will go on its own. But when you force it, it's still there. It's still there. So what you should do now is that you should visit this endocrinologist. They will conduct tests and find out the proper solution. Believe me, once you visit them, they will find out why your prolactin level is still increasing, and they will profile a solution. You going to lower it yourself cannot solve the problem. You will keep on lowering until years go by. But if you visit them and they check you, then they will prefer profile a better solution to you. So that is it. That is it. If you have been trying to conceive, some people will say, I've been trying to conceive for 20 something years, nothing is happening. I don't think it's possible. They will give up. It doesn't, it's the years that you have been trying to conceive is not the problem. Do you know when you will start counting that you are trying? Is when you start doing the right thing. That is the day you start doing the right thing. You might be going to wrong places. Like some people, they will go, they will give them this, drink this. If you drink this, you will get pregnant. Do you know what you are drinking? If you are a woman, I want people to understand it. If you are a woman and you are trying to conceive on your own, for if you are 35 years old, you have been trying to conceive for 6 months and nothing is happening, you should know that there is a problem. You need a help. This help now is not coming from your doctor. You need a special fertility expert. You need fertility expert. And that's your fertility expert. The first thing he or she should do is to conduct hormone test on you to check why you are not getting pregnant. If you are under 30, you try by yourself for a year. If nothing is happening, you need fertility expert. Don't stay on your own and be trying, praying. going there, they will give you this, you will drink, you go to church. If you like, when I know that God can do all this or everything, but there is some certain things you as a human being should do, then God will perfect it. We in Africa, I don't know, sometimes I said I don't know the type of mentality we have. We always believe that God can do everything. You see some people in the morning, they will not go to work, they will just go to church and be praying, God send us a destiny helper. Where will God send the destiny helper? You are not working. God says in his word, he said that I am going to bless the work of your hands. Now, you are not doing anything. You are not working. Will God throw money from heaven in the church? It's when you are doing something, maybe you are selling pure water, you are doing petty trade, you are selling tomatoes. Somebody may meet you one day and say, madam, is it only this pure water you sell to survive? You say, my brother or my sister, what can I do? The person will say, okay. The person will give you money or will help you to find a shop to start up a business. But you going to church, you sleep in the church from some people will not even eat. They will stay in the church. God send us destiny helper. Come from nowhere. I don't want to know. It's not coming in and it will not come until you start doing something. This is the same thing that is applicable in this fertility. When you are not doing the right thing, you don't know your circle. You don't know if you are ovulating or not. Some people, if you ask them, are you ovulating, they will ask you what is even ovulation. You have not visited, you have not conducted any test on yourself. I pity people in Africa. Sometimes when I remember it, I feel like crying because some people will have problem but they don't know where to go. And that is why I created this page to help people, to help women. Some people will have problem but they don't know. I was surprised the day I talk about endocrinologist. People are asking me what is endocrinologist. So if you have tried for 6 months, you are not getting pregnant, visit fertility expert. They will tell you what to do. Good day, my please. Breast milk discharge, the only sign of hyper. No, it's not the only signs. Some people do not bring out, like the person that her high prolactin is almost 200. She's not bringing out breast milk, and her period is regular. So she didn't know until she went for a test. So that's why I said always go for a test to know what your problem is. Then that is when you will start. Don't stay at home and say you have been trying to conceive for 30 years, it's not happening, I need to sit down. You see some people, when you ask them to follow this page, some people will say they have given hope. You don't need to give hope because you have not gotten what you want. So my people, I'm tired. I think I will stop here. Maybe next time when I have chance, I will also come. I just forced myself to come here because I received a lot of questions regarding this, and I discovered that this is what a lot of women out there are suffering. Some people is asking me, how does okra water work? I made a video. It pains me that still in my condition I squeeze out time to make video, and people do not watch it. It hurts me because I know what I sacrificed to make such video. There was somebody I had problem with. I made the video of, I don't know, the video of one smoothie that I made. She came to me in Messenger. That is why I removed my WhatsApp number and I said I'm not going to monitor anybody. If you want to, if you want to write comment, write it in this live. Now, if you write me comment in Messenger, now I will not answer you. Write your comment in this video, in this live, I will answer you. So she came to Messenger to ask me, say, I don't know what she asked me. I said, you people have problem. I squeeze out my time to make this video. Why not watch it? This woman, or I don't know, she gave me the insult that I have not received. Not only that, I blocked her because I placed my number in Facebook. What I did was that I studied her very well. I know her. So she went to my Facebook to collect my number. She came to WhatsApp and wrote the same nonsense. And do you know what? She's learning a lot from my page. She was using another page to watch me. So she never knew that I went there to block her. You are insulting somebody that is helping you. You are not paying me, I'm helping you. You are insulting me, you are still watching me. It's not possible. So if I make a video, please try to watch the video. The question you ask me will tell me whether you watch the video or not. If I make a video, you don't watch it, you come to ask me question, it hurts me because I devote my time. Actually, this thing I'm doing, I don't really need it. I'm just doing it for humanity, to help women. A lot of people have gotten pregnant through this page. A lot of people have learned a lot of things. Why not cool down to learn? If you think you have this problem, if you think you don't have problem, it's not for you, it's okay. But coming to insult me in my suffering again, and you still want to be back to watch it, that is not possible. And we should always mind the way we talk to people. You don't know me, I don't know you. You are just seeing me here, you don't know the type of human being I am. That's why sometimes we cause problems to ourselves. You don't know the person you are addressing, you don't know if the person is a human being. You will just be talking to people somehow, it may backfire on you. So whenever you are talking to people, especially people you don't know, you should make sure that you mind the way you talk to them. Thanks so much, ma'am. May the God continue to bless you and keep you. Thank you so much, my sister Richard. So if you have any other question, or people who will watch this video later, please write it write it in the comment section. And there is something I want to tell you people. Even if you are having this high prolactin, there is juice. That smoothie that I made, I used to receive this insult. Please always take, if you have high prolactin, that smoothie, always take it. Make sure that there is one lubricant. Even my sister Sarah volunteered herself to help people, our people. I understand that Nigeria is nothing to talk about, but then my sister Sarah here volunteered herself to help people buy it. And I said the price, I made a mistake in the price. I said the price was 15. By the time you buy everything, it will be 17 euro. So if you give her 17 euro now to buy this thing for you, what is she going to use to send it? You should pay when you buy something. If I buy anything online, these ones that I use here, I order it from Amazon. Maybe the thing will be sell 20 euro, then the shipping will be 5 or 7 euro. I need to pay for the shipping. She asked you people to pay for the shipping, and they were insulting her as if she's the problem of Nigeria. No, when you see somebody that wants to help you, please appreciate the person. Only going out alone, squeezing out time in this Europe to go out and buy that thing for you is not easy. And that lubricant, there is another one I posted, Presid works for some people, but that one that I posted, I forgot it, red retest or something like that. That one does a miraculous job. So if you have access to it, you buy it, take that smoothie, always detox yourself, and you will see. First of all, before you do all this thing, make sure that your hormones are balanced. So thank you so much. Until when I have time again, I will come. Always share my videos. Follow this page. Go to Miriam's kitchen, learn how to cook delicacy. After here, I'm still going to continue watching the video and watching there. And also share this video tomorrow. No, tomorrow, no. Maybe by the grace of God on Wednesday, if I have strength again, I will come here. I miss all of you. Bye bye all.